Going on, everybody? John Stamper here with Dental Cast Productions, and very, very excited to be coming to you this morning. As many of you know, the CSDA has put together this awesome CE package series where each month for the next 9 months, the CSDA is bringing in some of the top speakers in the profession and having them at the Aqua Turf Club. It's going to be some great courses, super, super relevant courses. As you may have remember, last month, I got a chance to speak with Dr. Peter Mullen, and he kind of teed things off and talked about how excited they are. And this morning, we've got the first speaker, Dr. Robert Lowe, who's coming to us from Charlotte, North Carolina. Dr. Lowe has been practicing dentistry for many, many years. I think we were just talking close to 37, and he's been in Charlotte for, a long time. And Dr. Lowe's course is going to be on restorative dentistry, which is something certainly that he knows very well. And so, Dr. Lowe, thanks so much for coming on this morning.
Well, John, appreciate it. It's a pleasure to talk to you.
Yeah,
I am definitely looking forward to coming to visit Connecticut again, the Great White North. Having migrated from Chicago, I forgot what snow looks like, so maybe I'll even be able to see some of that in September. I don't know.
Well, hopefully, I'm sure, as you know, for everybody living in Connecticut, it'll still be sunny and 90, but you never know, right, in that part of the country.
Yeah, exactly.
All right, so the course that Dr. Lowe is going to be teaching on, Restorative Dentistry 2019, and what we just wanted to do today is we're going to showcase kind of the 4 of the key areas. I mean, the course is going to go from 9 until 3:30, so a full day worth of insight from Dr. Lowe and all his years of experience with restorative dentistry. But we thought today we would just highlight for you 4 of the main topics that he's going to discuss. So I'll go ahead and put those up on the screen, and he'll talk to you a little bit about those. And really the first one is advances in direct restorative material. So Dr. Lowe, if you could touch on a little bit about what you're going to talk about there.
Well, I've practiced for 37 years, but I've also taught in dental schools. I taught at Loyola Dental School for 10 years in the 80s and 90s. And many of us remember life being a lot simpler back then as far as material selection go. A lot of times I say, I've got good today, and I say I've got bad news. And the bad news is we also got a lot of options today. So sometimes clearing the waters as far as knowing what material for what particular criteria can be a little confusing. And we do have a lot of advances in restorative materials that we're going to mention and talk about clinical applications and really give the dentist an insight as to, instead of the line always, well, I've been doing it that way for years and it works for me. The mantra will be, let's do what's best for the patient and use materials that are current and actually have some of them have some healing properties. So advances in materials, we'll talk about those different types of materials and clinical uses.
Excellent. And then I know one of the other topics, bioactive restorative materials, right? The future is here. I think that was one of the things that was put in the brochure about some of these newer materials. So talk a little bit about that.
Well, that kind of dovetails off of the first bullet. Now, bioactive for many people has always been, fluoride. Well, it's much more than fluoride today. It's replacing calcium and phosphate, the building blocks of appetite. So I think we can even be more conservative with early diagnostic tools, which we'll talk about. The Explorer is what Fred Flintstone and Barney Rubble's dentists use. We have other technologies now that allow us to detect things at a much earlier level. And we have materials that can actually help rebuild demineralized appetite at better levels than ever before. So we've got crown and bridge cements, we've got restorative materials, we've got buildup materials, we've got cavity liners. All of these materials now are in the more bioactive realm where calcium and phosphate ability really help give us the ability to help heal diseased tissues. That is a very, I think, hot.
Excellent. Still with us, Dr. Lowe?
I am.
Excellent. All right. Well, sometimes, obviously, when we're doing these things live, the internet can tend to give us a little bit of trouble, but I think we're good. So one of the other things I know you and I were talking before we started here was the aesthetics of occlusion. I know that's a big thing that you're going to present during this course as well.
Well, that is a topic that's near and dear to me. My mentor, Harold Chevelle, who I met when I was a dental student, probably one of the finest dentists ever to practice our craft, both aesthetically and functionally. For him, every restoration started from proper morphology and occlusion. And in today's world, where we're starting to get everything going toward digital and taking a lot of treatment decisions out of the dentist's hands, per se, and understanding and revisiting some of these areas, I think, is critical, particularly as we move forward in dentistry with milling and other types of procedures that take more of the restorative responsibility out of the dentist's hands and into someone else like a technician. So this is, I think, a very important area to revisit and for the dentist to hear about.
Yeah, excellent. And finally, technology. That's what we hear, right? I hear it all the time when I get a chance to talk to people, and certainly there are so many newer technologies out there. Where the rubber meets the road, as you know, Dr. Lowe, is how do these newer technologies that have been brought to the profession, how are they affecting the clinical outcomes? And so I know you're going to touch on a little bit about that, about things that you use, but more importantly, how they are helping dentists with the clinical outcomes, provide better experiences for the patients and things like that.
Well, technology is an interesting thing, right? I mean, as I talk to young dentists, everybody wants to place an implant, but they still don't have the basics under their belt yet. So taking things a step at a time is important. And it's always a challenge to the dentist to know what technologies to integrate at what time. I mean, obviously, technologies are not inexpensive. So it really comes down to, will the technology really help benefit the bottom line? But more important, I think, is does it fit patient experience? Because sometimes I think we get a little penny wise and dollar foolish in justifying expenditures. But at the end of the day, our most valuable commodity is chair time. So better outcomes, better experiences really do pay dividends. And I've been working with dental lasers for several decades, and we're going to talk about how integrating laser technology can definitely benefit, and digital scanners. I mean, people are going now towards scanning impressions rather than taking quote unquote analog impressions with materials. I still do both, and I think part of the technology challenge is knowing how to integrate technologies most effectively with techniques you're already doing. I don't think there's any technology that pretty much takes everything out of our hands yet, but the challenge is knowing. I'm 64 years old. Part of it is I like less stress on my job. So if the technology can help me do a procedure more effectively with less of a stress level and more of a predictable outcome, to me, that's worth the price. So we'll discuss some of those things.
Yeah, and you hear it a lot as practices are trying to differentiate themselves with their patients. And I know a lot of times patients are attracted to these practices that have made that investment, made that commitment, especially as they can do their own research now, and they know that a lot of these newer technologies are out there in an effort to make the experience better. And to your point, I think making that investment on the front end certainly helpful. But I think what's going to be great for everybody that attends your course is, like you said, being able to tie together why that investment is worth it and how you've been able to bring that into your practice, and most importantly, provide those better outcomes. Which, as you know, Dr. Lowe, that's what the providers are going to want to know. So,
right.
Excellent stuff. Well, very, very excited. I think certainly I know everybody that I've spoke with at the CSDA is really excited about the CE series. You're such a great clinician to get this thing kicked off. And everybody, just so you know, inside this video will have the link for those of you that have not registered for the course. You'll be able to click on the link. It'll take you right to the website where you can sign up, learn more about this course, get all that information and what have you. And as we continue the CE series, I'll be spending time with all of the clinicians just about 5 to 6 weeks before their course, so we can bring them on, have them share with you what they're going to talk about. You get to learn a little bit, learn more about them a little bit as we continue to educate throughout the state and those around that will attend these courses. So, Dr. Lowe, thank you so much for taking time this morning. We really appreciate it, and we look forward to seeing you at the course.
Thank you, John. Maybe next time we do this, I'll have to pull the guitar off the wall and strum a few chords. You never know. We might have to bring the band with us for the evening festivities after the lecture.
I love it. It's interesting. It's when we connected here, that was one of the first things I saw, and I'm glad you brought that up because I probably should have asked you to take it off the wall. But anyways, have a wonderful Friday. Thanks again, everybody, tuning in to the CSDA Facebook page, and we'll talk to you soon.
Thanks, John.
You got it.